Refractive eye problems. Have you ever looked at a written page and it looked blurry? Perhaps you have taken an eye exam and found that you couldn't read the signs very well. Maybe you have discovered that as you're getting older, you have to hold books further away to read them. So, you go to the ophthalmologist or optometrist and find that you need glasses because you have a refractive vision problem. For you to see clearly, the cornea, the transparent tissue that covers the iris or colored part of the eye, and the lens located behind the iris must bend or refract light rays, so they focus on the retina, a layer of light-sensitive cells lining the back of the eye. The retina converts light rays into impulses that are sent through the optic nerve to the brain, where they are recognized as images. If the light rays do not focus on the retina properly, the image you see is blurry. This problem is called a refractive error. Myopia, nearsightedness. Nearsightedness or myopia is a vision problem experienced by up to about 1/3 of the population. Nearsighted people have difficulty reading highway signs and seeing other objects at a distance, but can see for up-close tasks such as reading or sewing. Myopia symptoms and signs. Nearsighted people often have headaches or eye strain and might squint or feel fatigued when driving or playing sports. If you experience these symptoms while wearing your glasses or contact lenses, you may need a comprehensive eye examination as well as a new prescription. What causes myopia? Myopia occurs when the eyeball is slightly longer than usual from front to back. This causes light rays to focus at a point in front of the retina rather than directly on its surface. Nearsightedness, the vision problem, may stabilize at a certain point, although sometimes it worsens with age. This is known as myopic creep. Myopia treatment. Nearsightedness may be corrected with glasses, contact lenses, or refractive surgery. Depending on your vision problem, you may need to wear your glasses or contact lenses all the time or only when you need distance vision, driving, seeing a chalkboard, or watching a movie. If you're nearsighted, your prescription is a negative number. The higher the numeral, the stronger your lenses will be. Refractive surgery can reduce or even eliminate your need for glasses or contacts. The most common procedures are performed with an excimer laser. In photorefractive keratectomy or PRK, the laser removes a layer of corneal tissue which flattens the cornea and allows light rays to focus closer to or even on the retina. In laser-assisted in situ keratomyosis (LASIK), the most common refractive procedure, a flap is cut through the top of the cornea, a laser removes some corneal tissue, and then the flap is dropped back into place. Then there's orthokeratology, a non-surgical procedure where you wear special contact lenses that slowly reshape the cornea over time to correct your myopia. When the lenses are removed, the cornea temporarily retains the new shape so you can see clearly without the lenses. Presbyopia. During middle age, usually beginning in the 40s, people experience blurred vision at near points such as when reading, sewing, or working at the computer. This happens to everyone at some point in life, even those who have never had a vision problem before. Presbyopia symptoms and signs. When people develop presbyopia, they find they need to hold books, magazines, newspapers, menus, and other reading materials at arm's length in order to focus properly. When they perform near work such as embroidery or handwriting, they may have headaches or eye strain or feel fatigued. What causes presbyopia? Presbyopia is caused by an age-related process. This is different from astigmatism, nearsightedness, and farsightedness, which are related to the shape of the eyeball and caused by genetic factors, disease, or trauma. Presbyopia is generally believed to stem from a gradual loss of flexibility in the natural lens inside your eye. These age-related changes occur within the proteins in the lens, making the lens harder and less elastic with the years. Age-related changes also take place in the muscle fibers surrounding the lens. With less elasticity, the eye has a harder time focusing up close. Other less popular theories exist as well. Presbyopia treatment. Eyeglasses with bifocal or progressive addition lenses, PALs, are the most common correction for presbyopia. Bifocal means 2 points of focus. The main part of the spectacle lens contains a prescription for nearsightedness or farsightedness, while the lower portion of the lens holds the stronger near prescription for close work. Progressive addition lenses are similar to bifocal lenses, but they offer a more gradual visual transition between the two prescriptions, with no visible lines between them. Reading glasses are another choice. Unlike bifocals and PALs, which most people wear all day, reading glasses are typically worn just during close work. If you wear contact lenses, your eye doctor can prescribe reading glasses that you wear while your contacts are in. Astigmatism. Astigmatism is the most common vision problem. It may accompany nearsightedness or farsightedness. Usually, it is caused by an irregularly shaped cornea called corneal astigmatism, but sometimes it is the result of an irregularly shaped lens which is located behind the cornea. This is called lenticular astigmatism. Either kind of astigmatism can usually be corrected with eyeglasses, contact lenses, or refractive surgery. Astigmatism, symptoms and signs. If you have only a small amount of astigmatism, you may not notice it or have just slightly blurred vision. But sometimes, uncorrected astigmatism can give you headaches or eye strain and distort or blur your vision at all distances. Children may be even more unaware of the condition than adults, and they are unlikely to complain of the blurred or distorted vision. Unfortunately, astigmatism can affect their ability to see well in school and during sports, so it's important to have their eyes examined at regular intervals in order to detect any astigmatism early on. What causes astigmatism? Astigmatism occurs when the cornea is shaped more like an oblong football than a spherical baseball, which is the normal shape. In most astigmatic eyes, the oblong or oval shape causes light rays to focus on 2 points in the back of your eye rather than on just one. This is because, like a football, an astigmatic cornea has a steeper curve and a flatter one. Astigmatism treatment. Unless it is extreme, astigmatism can be compensated for satisfactorily with eyeglasses or contact lenses. If your eyeglass or contact lens prescription contains 3 parts rather than 1, your eye care practitioner has found some astigmatism in one or both of your eyes. A prescription with 3 parts looks like this: minus 2.75, minus 1.25 into 90. Hyperopia, farsightedness. Hyperopia or farsightedness is a common vision problem affecting about a fourth of the population. People with hyperopia can see distant objects very well but have difficulty seeing objects that are up close. Hyperopia symptoms and signs. Farsighted people sometimes have headaches or eye strain and may squint or feel fatigued when performing work at close range. If you get these symptoms while wearing your glasses or contact lenses, you may need an eye exam and a new prescription. What causes hyperopia? This vision problem occurs when light rays entering the eye focus behind the retina rather than directly on it. The eyeball of a farsighted person is shorter than normal. Many children are born with hyperopia and some of them outgrow it as the eyeball lengthens with normal growth. Sometimes people confuse hyperopia with presbyopia, which also is a difficulty in seeing up close but has a different cause. Hyperopia treatment. Farsightedness can be corrected with glasses or contact lenses to change the way light rays bend into the eyes. If your glasses or contact lens prescription begins with plus numbers like plus 2.50, you are farsighted. You may need to wear your glasses or contacts all the time or only when reading, working on a computer, or doing other close-up work. Refractive surgery such as LASIK or CK is another option for correcting hyperopia. It may reduce or eliminate your need to wear glasses or contact lenses.